What if the secret to perfect parenting was admitting that none of us have a clue?
The truth, we're two real moms figuring it out in real time and keeping it real along the way.
Each episode, we're calling BS on perfection and bringing you raw combos with parents and professionals who aren't afraid to go there.
Because what if the real parenting hack was dropping truth bombs instead of pretending like we got it all together? Let's get into it.
Welcome back to...
Welcome back.
This is a singing podcast now.
Yeah.
We're back with season 5, episode 3. We are going to talk all things VBAC and Breech because that's exactly what I'm going through right now. And it's not my first rodeo. So somewhat of an expert. No, I'm just kidding.
You kind of, honestly, you kind of are with two babies in a womb doing the similar things.
Similar things. And I wanted to just, put out there too. If you haven't watched, I think it's like one of the first 3 or 4 episodes. I talk about my septate uterus, what that is.
Yeah, we'll link that.
We'll link that. Yeah, we'll link it to this one because we can do that now.
Yeah, that's so
There's like
cool.
lots of linky things.
Yeah.
But basically I had a uterus where it was 2 uteruses. One might call it a uteri and one might call it a tuterus. But basically it looked like Mr. Crab's eyeballs if you really look at it. Like I'll put the picture right here and put Mr. Crab right here. And I got a surgery done. I think what I was chemical pregnancies all throughout this summer. And essentially I was just like, there's something up. And my doctor finally listened to me. She was like, okay, let's get the ultrasound done. You never had one done before. I'm like, no. Well, we found a septate uterus. She was like, okay, well we can.
So this is Easton.
This is Easton.
So you had chemical pregnancies with Easton as well.
I don't know for sure, but I
okay.
felt like I would have the implantation bleeding.
Yeah.
And then like a week later, I would get my period, and my period would always be late.
Oh.
So it was like 2 or 3 times when we were trying.
Got it.
So I felt like I was having these little mini chemical pregnancies. And I just felt, and you just know as a woman, as you guys all know, you just know something's off. I always felt like something was off my entire life, but no one listened to me. And until this OBGYN, that was great. So she got me an ultrasound. She was like, okay, you have a septate uterus. We could, you could do nothing. You could wait to have actual miscarriages, or we can get a surgery. A lot of doctors will make you wait to have miscarriages. She's like, which I think is so
kind of
evil.
Yeah.
Have a couple miscarriages and then we'll go ahead and operate.
So that we know that it's a problem.
She's like, I'm not going to do that to you.
I love that. Yeah.
She's like, I'm not going to do that to you. She's like, it's a pretty simple surgery.
Yeah.
And it was like,
and now being on the other side of miscarriages, like that, like all that emotional trauma electively.
Right. Like knowing that it could happen. Like
that's wild.
And knowing that in the back of your head, just crazy. So, I got the surgery done, and what they did is I have a kind of uterus that had the muscle in between because there's lots of different kinds of variations.
I guess that's the crazy part of design is like everyone is so different. Like if you think about, we have different like prints, we have different, like there's different boob styles, there's different, like, so why wouldn't there be different uterus styles?
Yeah. So it was kind of wild. So I was actually one that could be operated on because there's a lot that can't.
Really?
There's only like 2 kinds that can be, and I had one.
Wow, that's kind of a miraculous.
I was very lucky. But my septate went all the way down to my cervix. So they had to basically remove the muscle in between. And now I have more of a heart shape.
Aww.
Love. But the problem with the heart shape, as cute as it is that Easton's head got stuck.
Because it's still a lot of muscle up there.
It's still, like a muscle is like in between right here.
Right.
And
So basically as your uterus is growing, you have like these 2 open more areas for baby to kind of form into.
Right. And like if they're trying to turn, they're hitting that where it kind of meets.
Got it.
But with the second pregnancy, they're like, okay, you stretch out a lot more, and it's more likely that you are going to be able to flip a baby a lot easier than you were your first. And I've noticed a difference. Like I'm not as itchy. I've felt baby instead of being head up and head down, or head up or feet down. I felt it's more transverse. So they're more sideways, which is good because it's easier to turn that way. And I don't think that they're caught up here.
Right. Because Easton was completely breech.
He was completely breech. Yes. He was, man. I mean, like I posted a picture the other day, like you could see his head
That's
right
wild.
here. Oh, you're not on social media, so you didn't see it.
No.
I forgot about that.
I haven't been on social media. I don't know what's happening in the world.
People were like, wait, is this the lower part of your belly or the high? I'm like, no, it's the high. They're like, that's wild. It kind of almost looks like an upside down belly.
Yeah.
It's wild. So yeah, you can tell I'm very passionate about this because I've been living it.
Well, when you first in the other episode, like you had talked to me about like how you done like candle things on your feet, massages, things like that. So you're like, so you're already like kind of set.
This episode, honestly, if you are breech or trying to have a VBAC, this is the episode to watch. Because I'm going to go over almost I think it's literally everything that you could possibly do in order to flip a baby.
Okay. All right. So let's get into it.
Okay. So one of the first things that I think is really important is get yourself a really good chiropractor that knows the Webster technique. What they're going to do is they're going to release tension in your sacrum. They're going to make room for baby and make sure that you're aligned so your pelvis has room for baby to flip.
Yeah. But I mean, the big thing about any birth is pelvic floor, but definitely
100%.
here.
Yes.
Yeah.
Definitely here. And my last pregnancy, I started, I think pretty late, I think like 28 to 30 weeks. I have been going the entire time with this pregnancy. So we've just been working on it.
That's also too, if you're listening and you're in your first time pregnancy, like that's really normal. Even in your first like parenthood, there's a lot of things that I did later with River, not because you just don't know what you don't know.
Right.
And then you find out, right? You're like, hey, okay. So maybe you heard about this chiropractor, right? You're like maybe you heard about it in your first trimester with the first baby, but you're like, I don't know if I'm going to need that, or how do I know if I'm going to need that? Or is that the right way to go? And so you kind of like drag a little bit because you're unsure, as opposed to the second time around where you're like, I know that helped me and I'm going to do it. So you're more likely to buy into things and do them because you have tried them. So don't feel like if you're in your first pregnancy and you're like, I'm at my 20 weeks and I haven't, I'm breech and I haven't done that. I think it's just so normal to not know what you don't know because it's your first pregnancy.
For sure. And I actually had gone to a chiropractor before Easton and I didn't have a good experience. So I had pushed off until I realized I was breech. And
that's also important. And then you also, another key word is you were like, that knows the Webster technique.
Yes, that knows the Webster technique, which most do. I would probably do a little bit of research and ask around or go on, some like Facebook sites and say, hey, who's really good at breech pregnancies or who's
and
really
what is the Webster technique again?
Essentially they're just making room for baby. So it's like releasing tension in the uterine ligaments.
Okay.
So he like will kind of like stretch me out, like do like leg circles, just kind of loosen me up and then always like push
Which
down.
is also pretty good for probably around ligament pain then too.
So I've had almost none.
Wow.
I had more in my first trimester than I did now. Now, if I go and do something strenuous, I'm going to feel it, right? But I haven't had much around ligament pain and I have had almost no hip pain, which is insane because I had such bad hip pain my first trimester.
Oh, really?
So starting sooner than later, I highly suggest, even if you're not breech, do the Webster technique. This is not breech specific. Just go and do it.
Right. Because I mean, if you think of any muscle, right, let's just talk about working out outside of pregnancy. If you go and you start working out without stretching, you have more likely to injure yourself, which is why people say, hey, stretch a little bit. So in the same fashion, if you think about your first pregnancy, your body has not stretched like this.
Right.
So it doesn't know. So things like that can really aid it. And in your first trimester, I think people don't realize between your first and the baby is obviously very small, the size of a tiny mustard seed up to like, maybe a grape or an apple at that point. And so your body, you don't physically think that your body's changing that much, but your uterus is taking a huge leap, literally week by week.
They're preparing. It's preparing. Yeah. And then from my understanding, I didn't understand why I was having such early round ligament pain this time. And it is a hormone increase can actually affect those ligaments. She's like, oh, that's perfectly normal. I was like, it is. I was shocked. So yeah, just getting on a chiropractor as early as possible. If you're not really comfortable with chiropractors, doing your research and figuring out what the best one is. But he puts his thumb up, like almost pretty much up my butt to just like release the sacral release. But I can feel it just relaxing. And it's awesome. Yeah. Awesome to have a finger on my butt. It's not like up my butt. It's on the bone.
I had a finger in my butt for my, if you're doing, I mean, any birth situation, but the home birth, it's called counter pressure. And so in order for you to like push to get your body to push from the vaginal canal to, instead of trying to push out poop.
No, I think that's the same release.
Oh, okay, yeah.
'Cause
Because your sphincter, like you're having, it's a sphincter thing. You're trying, they're what it's trying to get you to do is release, because if you can release the sphincter, if you can counter pressure what you're doing, then you're going to release all your sphincters.
Oh yeah, there's multiple.
Wait, you have lots of sphincters. That's something I learned in class.
Can you just touch on that real quick? Because I remember talking about that one of the first podcasts, and I was like, wait, what?
Yeah, you have more. I don't know this. Well, we're gonna end up interviewing the girl that I took the class with at some point. But basically, you have a lot of sphincters in your body, and so if you think about when they are telling you to practice breathing, you're not practicing breathing as in like survival technique. Like you're not going because they don't want you to pass. I mean, maybe that's part of it. They don't want you to pass out during birth, but really to understand where to breathe in order to release certain sphincters in your body to allow your body to relax and release the other sphincters. So if you think about it, I don't know if this is counting as a sphincter, but where your tension points are. So if your jaw is tense, then likely so is your butthole. Because if you're squeezing, you're doing this, And so if you think about literally, if you do that right now, if you try to squeeze in everything, you can feel it all squeezing in. And so there's different techniques for birth, no matter where you're having birth or how you're having birth, on how to release those sphincters. But yeah, you have a lot more sphincters than you think you do.
And I just want to give a shout out to everyone that I'm working with too, real quick. Dr. Bradshaw is who I'm going to chiropractor. So if you're in the Nashville area, go see Dr. Bradshaw.
Yeah.
But getting into the next part, which is kind of, excuse me, piggybacking on what you're saying, is pelvic floor therapy, talking about releasing everything. What's so interesting about pelvic floor therapy prenatally is that you're kind of doing the opposite of what you want to do postnatally, is how I look at it. And that might be wrong, but don't quote me on that. But you're trying to make your pelvic floor get out of the way.
Yeah.
Versus building it back up after.
Oh yeah, 100%. Yeah,
so, essentially, like what you were just saying, if you're tense up here, then you're going to be tense down here, and you're learning to lengthen everything through your butthole.
Yeah.
And just teaching how to do that. So, I'm working with Dr. Carly Overbeck, and she is over in East Nashville. It's different than when I went for pelvic floor therapy. It's more customized, I would say. I just went to Star Physical Therapy after Easton. She's getting to the nitty gritty. Like we're doing internal exams. I don't know. Did you do?
Mm-hmm.
Yeah. I mean, she's got a finger and she's testing to see what's more tense and which side is more tense.
Yeah. And then she'll do that postnatally to see what is building strength back and what isn't. It's also, for people who your general practitioner is going to check whether you have diastases, but a pelvic floor therapist is the person that's going to say, if you're doing this prenatally, is going to say like, hey, it's happening. Here's some things to, I don't know if you can prevent diastasis, but you can definitely help yourself. And they are the people that are going to help you build that back as well. So, I mean, it's all connected down there from your pelvic floor.
Yep. And
which is why what's crazy to me, knowing now what we all know, is the way in which hospitals prefer you to birth. Because that is totally opposite of what getting your pelvic floor out of the way looks like in other situations.
Yes. Like you should really be on your hands and knees.
The best actual one is to be sitting on a toilet.
Yes. Yeah. You should be like
letting things drop.
Yes.
Letting gravity do the work.
Gravity doing the work. And it's just interesting. Like you have to think, like you want to do these pushes, but like you have to actually relax your body. So I'm learning how to do that.
We should we should see if Carly would do it. Cause what I love is when they bring the pelvic floor to show you, because I think the physical I'm very visual. And so to see when I first talked to I went to Dr. Amy Bailey, who's also in Nashville and is amazing. But when they just like showed me the bones and they were like, okay, so when you do this, it's going to look like, and you could see the closed hole versus this extremely open hole of your bones. It's a wild, it's so informational that it's cool. So if you're into that kind of stuff and what's happening with your body, I like highly suggest that. Plus obviously the benefits of that, because another thing I learned from pelvic floor therapy is that leaking is not normal.
Right.
Just because it's common doesn't make it normal. That's what Dr. Amy said. And so I don't have any leakage. Like I don't it's not, obviously it's common to have leakage post 2-3 babies because your body is, takes a
Even
wreck
when
from
you
it.
jump rope?
Yeah, I don't leak when I jump rope.
That's amazing.
Yeah.
Well, maybe Dr. Carly will do a better job.
Yeah. The build back, right?
Yeah.
But yeah, definitely. So even if you're not pregnant or postnatal, and you're seeing yourself have like leakage or whatever incontinence problems, highly suggest going to pelvic floor therapy.
Yeah, I think it's definitely underrated. I think it's getting out there a little bit more. I've seen it a lot more, but like it's definitely an underrated tool, and I think people don't know about doing it.
Yeah,
like before.
I mean, if you think about it, really, our generation, maybe the generation before us, is really the start of the generation that sits on those bones much more, right? We're much more sedentary than we have ever been.
Mm-hmm.
And so that pelvic floor is going to take a hit. And that makes sense why someone like Dr. Amy or Dr. Carly now shows up in the world, because what are you doing when your body is super sedentary and resting on this, like, I don't know, it's the biggest bone in your body, but it's definitely like one of the most significant bones in your body.
It really affects everything.
Mm-hmm.
It really does. Another thing she does is I actually went on like a world tour this past Friday, and
You went traveling? I thought you can't travel.
Well, I can't. That's why I went on the world tour of basically trying to get the baby unbreech, the flipping the baby day. Do you remember on Friday I went everywhere? So I started out my day with pelvic floor therapy, went into what we're going to get into in a little bit, acupuncture. And then I went to the chiropractor, and I'm pretty sure I woke up. I don't know. I didn't think I told you this. I think the butt's here right now.
Oh, wow.
So yes, but I did a couple things. So we'll talk about that a little bit later. So the great thing is that she meets me where I'm at. Like I think normally at this part in my journey with being pregnant, my pregnancy journey, I would normally be starting to do more push techniques at this point. That's what she would normally focus on. And we've done a little bit of that, but she's like, scratch that. We need to concentrate on step 1. Let's flip this baby. So she just like massaged and got me so just soft. Like there was like no tension.
Wow.
At all. Like when I got to Bradshaw, he was like, you are loose. Like
that's great. That's crazy.
it was great. So, I mean, she had me on an inverted table, was just sitting there massaging me. Just like, it was great. I was very, very relaxed.
It wasn't painful at all?
No, it would just felt good. And just like, you could just tell the way that she was pushing and this and that. But she did a lot of work. We did some sideline releases, just really was able to relax. It was nice. So yeah, she really does meet you where you're at. That's my whole point. And just, then we will get into pushing technique. And she will internally make sure, hey, like, is it a good push or is it not? So check. I'm good on pushing. We just got to get, there. Let me see if there's anything else that I want to mention. Yeah. And I think that the pelvic work too is also probably contributing to the non-hip pain, because I'm able to be more mobile in my hips, and learning that. So there's lots of different exercises to do as well. And to concentrate maybe on one side and not the other. So really, really good. Next one, number 3, is a Mayan abdominal massage, also known as how do you say it? You did this. Arvigo massage. It's a traditional technique focusing on improving circulation to the uterus and pelvic organs.
Yeah. It's good for prenatal, it's good for during pregnancy, and it's good for postnatal as well.
Yes.
Because you're basically the idea. So I did it prenatally. And I didn't do a follow-up, but I did it prenatally. And because I was having the cultural idea, even my grandmother in Thai culture, the idea is that like they say like your uterus got twisted. So in birth, right? Birth happens and then your body has to go back down. And so, maybe there isn't enough blood flow, or maybe, not that there's not enough blood flow as in like you're in pain or whatever, but that you're basically waking up your uterus.
Your circulation's a little off.
Right. And so they'll do one prenatally. That for me, 1 month after that's when I got pregnant with Lenny. And then you're doing it during pregnancy.
I actually had it scheduled when I was trying, and then I got pregnant and I canceled it.
Oh, really?
So yes.
Okay.
I was
doing it now?
You told me to go do it, and I'm doing it now. So I did it, I think around 22 or 23 weeks.
Okay. So what are the benefits during pregnancy then?
So basically it's kind of like everything else. The biggest thing about having a breech baby is you want to make room for the baby to flip. So we're just creating space as much as we can. So just getting everything loose and like the circulation flowing, the womb. I think it's really called a womb centering massage is what they like to call it. So when the uterus is more balanced, it may give baby more room to move and potentially turn head down. Many women also find it helps with digestion,
Definitely does that.
Yeah. Pelvic comfort and overall relaxation during pregnancy. So like you're getting them like rubbing your belly, which feels so good.
Because people say like go get a prenatal massage, but what you don't realize in outside of the Mayan one, what that means usually is that they're supporting your belly and they're massaging your back and other things around there that are pregnancy safe. And so those are definitely relaxing for mom, and you should totally, but if you're in a space where you need focus on the belly, that's when you would seek out someone like an RV massage.
And they also do the rest of your body.
Yes.
So like you're getting a full body effect.
Right.
But they do start with the belly and then like work away. I mean, think about it. Like you start at the belly, work the circulation, then they have to get everything else flowing too.
Yeah.
So the circulation.
You know what's so crazy when you say like create space, because it's something that I heard even in labor, and you're like, well, how do you create space? What you're not realizing is that your body is obviously it physically is creating space, but you're creating spaces in like you're loosening the muscles around that, because that's everything's tightened. Even when you think of Braxton Hicks and you're like, oh my gosh, my belly feels like a rock. Even before you hit Braxton Hicks, your body still is your body. And so the muscles are going to tense or loosen depending on, how early, how quickly, if you get bigger quicker, they might tense faster. Cause again, you're thinking of stretching like you would before you work out. So this is it's such a crazy ideal. Cause you're like, what do you mean create more space? But you're like, oh, my body can actually expand as much as I let it. With great massaging techniques like that.
Then pairing it with the chiropractor and the pelvic floor therapy, opening that pelvis,
all connected.
It's all creating space.
Yeah.
So that was the main reason. I think I talked about this a little bit. I did my first 28 weeks prenatally with a midwife service instead of going to a traditional hospital, because these are techniques that they told me about to prepare my body for 20 weeks to create this space.
And no offense to any of the OBs, and they're probably great. And there might be great OBs out there that can suggest that, but I totally agree with you that my level of care from midwifery from my first pregnancy of just seeing an OB. And then again, I didn't even really know about doulas until 20 weeks pregnant. And I was like, oh, okay. So when you know better, you do better. And you're like, okay, I need to be supported this way. Like I want to make sure, I knew that I wanted a home birth and I wanted to make sure I had the best possible chance at a successful home birth. You want the best possible chance of a VBAC. And so you have to get uncomfortable and ask questions. And so if you're seeing a traditional OB right now and you're saying, hey, this is me, you can always request to talk to it. Like a lot of hospitals actually have midwifery services in there, but you can always go outside and speak to a midwife or request midwifery consultation to just get the things that you don't know,
I mean, if you guys are in the process right now, like you said, with an OB and you're noticing that the OB comes in 5-10 minutes and that's it, like the midwifery will schedule a whole entire hour with you to really see. And like for us, we went to the same place. And they had, I don't know if everyone has this, but they have like a little tiny like
couch.
Ultrasound machine. Well, you're on a couch. It's very nice. It's very, really cozy. But like the little ultrasound machine, like you're able to kind of see a little bit more and get like a little sneak peek. I don't know if you did that a little
I
bit
didn't
more.
do that.
We were, I was like, can I see them?
Oh, I didn't. Yeah. I didn't even know that.
I want to make sure they were real at that point, especially in the early days
here. Yeah. But no, I think that it's really important as you're going through pregnancy is to, how do you best need to be supported? If you're a type A person, you're like, I got this all down. I've done all the research. I don't need help. That's great. I would really highly suggest that you maybe do some self-check though, because there's always so much that you can learn, especially within like the OBs. I think here's what it is. OBs are great for is everything on the up and up. And when things are not, what are the options, right? So definitely there is a level of care that an OB can suggest. And some OBs may have, like my OB personally was not a fan of midwives or doulas. Like
really
made it very clear. And some OBs are, because some OBs, you're a doctor, you've had a different level of schooling. Doulas are not medical doctors and midwives are not doctors. So there might be a mental, like you feel like you're better than them a little bit.
Ego.
There might be a little ego involved.
Yeah.
Or they just generically don't know. And some people don't like not knowing. So if you ask a question of an OB, they might feel defensive simply because they're like, why don't I know this? Right.
Yeah.
And so
Like, I'm the doctor. I should know this, and I don't know this, so I'm going to just blame it on you.
and then in the same way, when we interviewed Dr. Kalstein, and she made a note, and her obviously she's why just escaped me what she does.
Naturopathic medicine.
She's naturopathic medicine, but what she said applies everywhere. Is that there are different levels of specialties that people focus on. So the naturopath focus on everything, right? OBs focus on the clinical side of it. If you need a more, I hate saying human, but really, if you need
bedside
a more human or naturalist view, you know, like the midwiferys are tending to specialize in naturopathic remedies, or maybe they have a homeopathy ideal, or maybe they know where they want to place you. Like they're like something more. I hate using the word natural, but that's the only things that come to mind. But more holistic view than maybe an OB would. So
right, they just have more techniques under their belt. Where an OB, to put it this way, I'm delivering at Diana, and it's a midwife-centric hospital. So if I go into birth, I may never see the OB because it's going to be midwives and my doula driving everything. But the OB will step in if anything goes wrong.
Yeah.
But yes, they have like a lot of more techniques under their belt, and they're willing to try different positions. They're not just, saying, hey, get on your back, let's do an epidural, let's, induce you, whatever. Like it's more, they work with you and they work with different positions and this and that.
Right.
And
they have to be more physical and more involved because they don't do things like epidurals.
Right.
Right. Like unless you're going to a midwifery hospital,
yeah.
But like a home birth, or if you're just with a midwifery service doing generally speaking, they don't have that on hand because they can't do that. Right. And they can't prescribe medications and things like that. So if you need more of that clinical, whatever, for whatever reason, physically for mom and baby, then an OB is good. But there's always more of, there's always more to learn. And I think that midwives, they definitely have a special place in the world.
Yes. Yes. 100%. I love midwives. They're so nice.
Yeah. Support mom and baby.
Yeah, they do. All right. Moving on. Is this number 4, I believe? Yes. Number 4 is acupuncture and moxibustion, AKA the toe candles.
The toe candles. Okay. So we're still doing the toe candles.
We are doing the toe candles. I've actually even stepped it up and have been doing the moxibustion stick to really just get the juices flowing. So acupuncture is going to help regulate the nervous system and reduce stress, which supports those healthy pregnancy hormones. And then a lot of people will use it for if you're sick, like in your first trimester, go to acupuncture. It'll help with nausea, insomnia, and the back pain. But the moxibustion is where I really was so skeptical because it's okay, it's a toe candle. It's not even a toe candle. It's like a toe incense, I would say. It's like a little, it's from the moxie plant. Oh gosh, what is it? I think it's the moxie plant. But basically what it does is smelling it actually will cause the uterus to start to
okay, so why by your toes?
So there's a pressure point by your toes that stimulates the uterus, and also smelling it. So I've been doing honestly a little bit of overdose on the moxibustion. Sometimes I'll put the toe candles to stimulate it. Sometimes I'm I can't smell it because I'm just so used to it now that I'll also do a stick and let it burn, and the baby goes nuts.
Really?
Baby
okay, you told me this about
crazy.
Easton though too, right?
Easton
went nuts.
Yeah, but he was just stuck. He was just sitting there ping-ponging in my heart. Baby goes nuts. I feel crazy movement every single time.
Wow.
So then I also started doing, we'll get into this too, is I started doing exercises with Moxie to try and get them to flip. But yeah, I think it's one of the coolest tools in the belt.
Yeah, I don't know enough about it. I love hearing about it because I don't even know what the origin of it is or where did that come from?
Here, this is mugwort, not moxie plant. Moxibustion is a traditional practice where a warming herb called mugwort is burned near an acupuncture point on the pinky toe. This point is believed to stimulate fetal movement, which may encourage a breech baby to turn.
Wow.
Which I feel
specifically for breech babies.
Yeah. So,
or if you just want your baby to go nuts.
If you
want hey, I would like a little movement over here.
Is your baby alive? Okay, mugwort. No. So yeah, basically, I love it. It's
That's
great.
Great.
Such a good feeling. I don't know. And some people hate the smell and they'll get sick of.
What does it smell like?
It's like an incense.
Oh, I like incense.
Justin's like, thank God I actually like the smell of it. I'm like, yeah. Because a lot of people
you're like, it's all going through the house.
Air doctor's going nuts.
Oh yeah. Hannah says, what is this?
Like, what's going on? So yeah, I highly suggest the moxibustion. It seems really woo-woo until you guys try it. Get some mugwort and
Get you some mugwort
and have a party. One thing I just bought and what I was getting into, this is number 5, with the moxibustion is I just bought the birth sling. It's by Dr. Jess Michaels.
Where you just hang.
Yes. Yeah. And it's, I think it's a little pricey, but it's like $150, I think.
Yeah.
But I just was like, all right, let's just grab it because I can always sell it again.
Yeah,
like
double use though. If you're having a
Yes.
home birth, or even at the hospital, sometimes they let you put that sling up. It's good to like for movement in labor because
Yes.
it really starts to hit, because it hits those pressure points. It helps pain, or just labor pains basically.
Yes,
So.
and you can just slide it over just to any door, or you can actually install it into your wall. I like the fact that you can just put it over a door very easily. Like you could do it in the hospital room, bring it in the hospital room. So it's yes.
Just don't let anybody open the door.
Yeah, just don't let anybody up. So use the bathroom door.
Yeah.
But yes, and there's like a little sign that comes with it that says "Do not open door."
Yeah.
But yes, it's awesome for getting your body prepped for labor, and also it's been helping just kind of loosen everything up. I don't like doing forward inversions on a couch, and for some reason, it like hurts my knees, or I just feel like I sink
Well,
weird.
you have fun knees already.
I have fun knees and Achilles. It's yeah. So I just don't feel like I'm getting all the way in it, and like I sink too much in the couch, and I'm able to just kind of do more of a downward dog kind of position with the sling on my legs,
And you feel supported.
and I feel supported, and I can sit in the inversion a lot longer.
Yeah.
So yeah, I love the birth sling. So any other points? Yeah, it's a safe, supported, hanging, and gentle inversion during pregnancy. They can help take pressure off the pelvis and allow baby to move more and give more space to reposition. So it's all about the space. And then just releasing tension. And yeah, it's just like an easy, like it's sitting right there. I can just do it for, a couple times a day.
And this is probably a good place to stop because we're like, oh, you and acrobats now too. It's probably a good place to say, by the way, before you do any of these things, you probably need to consult your healthcare professional, because we are not here to tell you to do these things, then you end up in an accident. So
right.
Definitely the most important thing is that baby and mom are healthy and safe, and then bring all these ideas to the person in your care to say, hey, I'm thinking about doing this, because it mugwort could be great, or it could send you into labor. I don't know, but I would definitely consult your healthcare professional before doing any of the things we're talking about.
100%, because there might be something that you might have that I don't have, or whatever.
Right. And you need to see someone to show you, because we're just telling you these techniques. If you go and Google it, like inversions, to your point, like I was doing them totally wrong until I saw both my doula and my midwife was like, hey, you probably need, like, because I'm shorter, so I needed more lift. You're taller, but you're longer, so you probably need more lift. And so just like you would have a personal trainer teach you how to use certain weights, you need a healthcare professional to walk you through some of the things that we're talking about.
Yes. Like Dr. Carly literally was like, okay, like move back this way, move this way. Yeah. Like you definitely do. Like all these things that I'm talking to you guys about they were recommended to me by these professionals. So,
okay, this is one of those brands that once you switch, you literally don't go back. I also feel like it's one of those small changes that actually makes a big difference in your home, especially as a mom. I'm talking about Truly Free. And what I love is that they're all about non-toxic, safer cleaning products without all the harsh chemicals. Because let's be honest, we're constantly cleaning surfaces our kids are touching, crawling on, putting things in their mouths, all of it. You know what I'm talking about, y'all. And I feel like a lot of us grew up thinking the stronger, the cleaner, the better. I'm talking about the bleaches, the ammonias, the stuff that just burns your nose hairs. Like everything does not need to be completely disinfected all of the time. But the reality is the super harsh cleaners like bleach don't just kill the bad stuff. They wipe out basically everything, even the harmless bacteria. And while there's definitely a time and place for that, like someone's sick with a norovirus or you're dealing with something heavy duty, it's not really necessary for everyday cleaning and can actually be more harmful to our health than good. For daily life, especially with kids and pets, using something gentler and non-toxic just makes more sense. And that's why I personally love Truly Free. It makes that swap really simple without feeling like you're sacrificing clean. They have everything too: laundry, kitchen, bathroom, so you can slowly replace what you're already using. Are you already using Truly Free? Great. Our code works for both new and existing customers, which is amazing. So you can use code TRUTHMOMS, that's TRUTHMOMS, for 30% off your entire order site-wide. Whether you're just starting to swap things out or restocking what you already love, just head to our link, shop anything on the site, and use code TRUTHMOMS for 30% off. And guys, make sure you're checking our page because they're always updating their bundles and starter kits. So if you want the latest options, you can check out our separate link for the most up-to-date deals. This episode is brought to you by Needed, a brand I genuinely love and have actually been using for about 2 years now, during my trying to conceive journey and now throughout pregnancy, including over a year before they ever reached out to partner with us. One of the things I appreciate most about Needed is that their supplements are formulated based on what women actually need nutritionally, especially during fertility, pregnancy, and postpartum. A lot of prenatals on the market are underdosed or missing key nutrients. For example, many prenatals don't include enough choline, which is really important for baby's brain and nervous system development. Good news is that Needed recently reformulated their multi-essentials prenatal and actually increased the amount of choline from 150 milligrams to 200 milligrams, which is amazing to see because it's such an essential nutrient that's often overlooked. Right now, I'm taking the reformulated multi-essentials prenatal, but I also love their collagen protein. It is such an easy way to get extra protein in, and the collagen supports things like skin, joints, and tissue support during pregnancy and postpartum recovery. I also just went ahead and ordered their iron support because I naturally tend to run a little low on iron, especially towards the end of pregnancy, and I want my levels to be strong going into postpartum because we all know that little baby just sucks the life out of us, right? And I love that theirs is formulated to be highly absorbable, which is really hard to find, and super gentle, which is also really hard to find. What's really cool about Needed is that they support women through every stage of the mother span, not just pregnancy. They have products for general women's health, cycle support, trying to conceive, pregnancy, postpartum, and even perimenopause. If you want to check them out, go to thisisneeded.com and use the code TRUTHMOMS, that's TRUTHMOMS, for 20% off your order.
This is one that I've tried. I felt a little bit of movement. It's number 6. It's hot and cold therapy. So putting like a heating pad towards the pelvic region and then putting cold here, like an ice pack. So I felt a little bit of movement here and there. But it can encourage baby to move head down. People also say put music down here and they'll want to go towards the music.
Oh, wow.
And then
yeah, that makes sense. You're creating a warm environment for that. So the cold environment would cause them to not be happy with that situation and wanting to go into warmer.
They don't like it. I'll say that. Like I felt movement, but it didn't do it for me. Like,
yeah, not like the mugwort.
Right. Cause I've got a weird uterus. And then kind of the same idea, number 6 is essential oils. Putting peppermint at the top of the belly and then putting myrrh. I think I'm saying that right. Myrrh. MYRRH.
Yeah, myrrh.
Yeah,
like frankincense, myrrh.
And then they want to move away from the peppermint oil because it's a strong scent. And then oils like the myrrh near the lower abdomen are traditionally used to encourage grounding and downward movement.
Oh.
So every appointment that I went into on Friday, I was putting that here and there when I was doing everything.
Oh, okay.
So yeah, it
I
feels
didn't know
good.
that one. Yeah, I personally like the smell of peppermint oil, so I would not mind it up top of my belly.
Bradshaw was like, I'm loving the peppermint. And then these are really traditional ones that you guys might have heard of or somebody suggested to you. Spinning babies.
Mm-hmm.
I have like
spinning babies is good for everybody.
Yeah,
it's good for everybody.
Should do it.
Yeah, spinning babies is definitely good in your. I think it's like what after 28 weeks, 26 weeks.
I think so. It's in here somewhere.
And that's just to encourage baby to get into position. Like,
when you
so
hit
for
third trimester.
whatever you're doing, because I didn't have my babies. My babies did not. They were like, once they were in position, they never got out. But your baby keeps doing this like flippy floppy thing. Like my babies, I told her the other day I texted you and I was like, my babies were lazy.
Yeah,
they were like,
I was
okay,
like,
good. We're here.
so-
We're fine. And everything's cool. I'm not doing anything else.
So jealous. It was so funny because Easton now loves to do like handstands, like on the couch. I'll just walk in and he's in a handstand. I'm like, why couldn't we do this? Have done this like from day one. I'm like, what are we doing? Like, he loves to flip. He's like, look at my cartwheel, mom. I'm like,
He's like, Mom, I'm not in a uterus anymore.
He's like, I'm free. But there's like 1, 2, 3, 4, 5, 6 different movements that you want to start doing. I think it starts in the 3rd trimester. Now I'm not at this point doing every single one. I'm just kind of cherry picking some of the ones that I felt really big on that forward leaning inversion.
Yeah.
Really big on the side lying release, but I'm going to start to probably incorporate a lot of these, but some of them is like a Rebizo I don't even know how to say it. I'll put it down here.
Can I see it?
Yeah. But basically you're on like a ball and like your partner's like just shimmying your belly.
Yep. I like that because we used to call it shaking the apples.
Yeah.
Or shaking the apples.
So you can use the burst sling to probably.
I personally like the sacral release. That was good. Oh,
Yeah.
it felt so good when he was just like squeezing the top of my bones, and then
Yes. And
I didn't like side lying release.
because you feel like you're gonna fall off the table.
That's true. Yes, that is what it is.
I did that a lot in my first pregnancy. With
Oh,
Easton.
what is that? Rebozo mantiata.
Yeah.
Oh yes, I just called that shaking the apples
Yeah.
because then you just like I think about it all the time. I love it so much. It reminds me of there was a TikTok trend that went around for a while of like walk behind your wife and pick up her belly.
Yes.
The problem is what it really made me angry, and it could actually hurt mom and baby if you drop that belly too fast. But they were
Yes.
doing it to be like douchebags on the TikTok, and obviously it was going viral. But it's not fun because it hurts. And PJ never did to me, but just like that feeling of like something lifting so gently to your belly and just like taking the weight up. That was the best.
It's the best feeling. I remember crying 2 days postpartum because I think I could actually start feeling things after the C-section again. And just being like, there's just a weight just lifted off. I was just crying for 2 hours. I just was like, are you okay? I'm like,
no postpartum.
great. I'm fantastic. He's like, okay, I'm going back to sleep now. Anyways, then a breech tilt. So actually we have an inversion table that we borrowed from a coworker. And I've done some breech tilts where I'm going backwards, but you just kind of lay backwards. In this picture, they're lying on a ironing board. That
I would not suggest an iron. Yeah.
Maybe just kind of.
I will say it's so funny when we were talking. So we had for the midwife and the doula before when you view a home birth, they come in because they want to see the space. And my doula was like, well, you could use this and use this. And there was like different baby things that she was like, you could just stand on here. I'm like, I am not doing that, but you truly like sometimes you just use whatever you have.
Yeah. It's just that.
Because it can get expensive. I mean, how much is that inversion table?
I have no idea, but
or maybe there's one at the gym, but you don't want to be like silly. So there are ways to get creative, especially with spinning babies.
Please, if you do the inversion table, I tried to do it while my husband was out of town this weekend. And thank God I was doing it in the garage. My neighbor Janet was walking by. I was like, Janet, can you help me get off?
Well, especially because you're so heavy up there, right?
I didn't realize because I had done it before and gotten off just fine, but I've gained
baby,
so much.
Yeah, baby's in weight gaining stage.
Yes, so
and the baby's measuring
a little ahead, which I'm always behind. I've been behind this entire pregnancy.
Lenny was ahead too, so maybe you're having a girl.
Maybe it's got chubby cheeks.
Oh, I love a chubby cheek.
I know.
Babes.
I'm like, oh well. And then it's probably gonna come out. It's just probably just smushed up something. It's gonna be all lean. Because me and Justin were lean babies, so it makes sense why we would have another lean baby. But hey, I'm all for a chubby little baby. And then resting. So the way that you want to rest is probably more on your left side. So I'm resting with my pregnancy pillow. Pregnancy pillow also is a really big thing.
Yeah, there was this, wait, is it left side? It's left side, right? There's something about the right side. Is that where your liver is or something?
The heart. I'm pretty sure it's
got it.
with circulation.
Okay.
Then getting into, I think this is number 6 or 7, is Miles circuit.
Yes.
This is something you typically do closer to labor or in labor.
Yeah.
But there is a way. This is how I laid after my world tour day of flipping babies, and my flip the baby day, we'll call it. I did what's it called?
Baby round the womb day.
Yes. I did the exaggerated left side laying. So you basically want all these pillows and you're just like pretty much on your belly, but like you have so many pillows around you that you're not actually on your belly. I woke up and that's when I was like, there's a butt here. There is like, I felt heavy. It was more like the head you could feel was like a perfect little round head. This was more like, I was just bigger and I was feeling all my movement here. So highly recommend doing that. But for the mile circuit, it's 3 movements and it takes about 90 minutes to do. You want to do like some round circles on a ball, open knee chest, just sit. I mean, you just sit there for a while. It's kind of wild.
I did my mile circuit. So I don't know if I would do it with a third baby, but for River loves to sleep. So I would get up at like 6 o'clock or 7:30. Cause she would get up at like 8:39, but, I would like 6 o'clock or like even 7 o'clock. And, I would turn my red light on and I would do my mile circuit. And that was the best. And I would just listen to, at the time I was listening to Hypno Babies, which is another great technique, for, birth if you're trying to do low, interventions. But I just had my Hypno Babies on. And I was just like listening and doing my mile circuit. And it was actually pretty meditative. So if you have problems with being in silence or like in space, like put a podcast on or get something that you can get you into a meditative state. Like right now, if I were pregnant, it would probably be freaking Bible. Just like things that just will get your mind off of what you're doing, because it is a long adventure.
It is.
90 minutes I mean, 5 minutes is a lot, you know?
Yeah, for sure. And like, then you would do like moving lunges. This is kind of like where the curb.
Yep. Lunges and curbs I did to get the baby moving in labor to start, keep the labor process going. Cause we were a little stalled up a little bit.
Yeah. So spinning, I think that like people can kind of get these two mixed up. Spinning babies is really getting that baby from a breech position or like a transverse position down, head down. And then the mile circuit is going to let the head get into even a better place.
Get the head deeper. Because once the head is deep in the pelvic floor, then the baby does not have a chance to flip again.
Right.
So you're trying to get the baby into the tunnel. Like there's like different, I think you went, what was it? Like -1, -2.
Yep.
Whatever it
stations.
is. Stations.
Yes.
That's it.
Yes. So there's that. And then going into, I think it's 7 or 8, I've lost count at this point. I've held off on doing this, but I'm planning on doing it. We're going to have her on the podcast, as you mentioned, Katie Dunning, doing a VBAC prep class. Only reason I've personally held off on this is because I don't want to spend money if I don't, if I'm still breech. So I'm waiting until like the last possible minute to like do a VBAC class, but I plan on doing it. It's in my toolbox.
Well, hey, maybe we can just get her. Maybe we can do like a little mini prep on the pod.
Maybe
get a few things.
But basically, it's a specific class that focuses on the understanding of birth after a previous C-section and how to prepare physically and mentally. They talk about the VBAC success factors, hospital policies, and how to advocate themselves during labor.
Yeah.
So, really big thing. I was actually supposed to give birth at the Vanderbilt Birth Center here for Easton, and I could not do it my second round. They do not allow VBACs. So I was really upset to find that out. But like it is like you need more.
It is a higher risk because not that you can't do it or that it's impossible, but there are, I mean, it's called uterine. It's basically like the uterine could pop because if you're thinking about it, you've cut your uterine wall. And so some people might scar and it would create a bigger tissue, or it could actually make it less.
Scar tissue can affect
can affect the elasticity of the uterine, which would cause an eruption, and abruption is what they call it. So I don't want to get anyone scary when I'm talking about it, but it is a factor to assess, and that's why you elected to say I'm not going to do a VBAC home birth. I would rather do one in the hospital.
Exactly. Just
so you're taking those precautions.
Anything were to happen, and plus I said it on the podcast before, I would get so distracted being at my house. I'd want to start cleaning and organizing things and hosting people. I wouldn't be able to get in a good mind space, and not that a hospital is like that much better for other reasons.
No, but you're taking care of, like, you're not worried about the environment.
Right. Like when I'm out of my environment, that's why I have to go and do editing at a coffee shop. Like I just don't worry about those kind of things.
Yeah.
I can just sit down and focus. And then getting into kind of the Hypno Baby stuff, is, I don't know if you did this, Karen Weldon's pain-free birth course. I just started doing it. She goes, I think it's like a 6 or 7 module thing where she just gets you mentally prepared for pain-free birth and talks about like the benefits of I almost said Oxycontin. I almost said Oxycontin. Yeah. Oxytocin. And then teaches breathing techniques, relaxation, nervous system regulation. A really big emphasis. I'm only on module 1. I've only finished that one. And it's removing the fear around birth. And it's just like getting into that. And she also goes into a lot of different spiritual things. And it's very centered around God. And then she also has the hypnobirthing music. Right. And is it like more talking? I haven't listened to it yet.
There's a lot of talk. There's some where it's just like, hey, you're going to take some breathing techniques and then they're going to play the music and you're going to listen. I fall asleep all the time, which is great. It's good news because it means I can relax my body. But the idea behind it is, I do have a little bit of a paying problem with pain free, because I think we have to say like pain, like understanding the idea behind, I get what she's saying though. The idea behind it is that we don't want you to associate, like your body doesn't know the difference, right? Of this labor and you're safe versus you burned yourself on the table or the pot or the stove, right? So the idea of pain is the same. Your body is experiencing a distress. The idea behind these classes and why they're so important to do any type of, because I did hypnobabies, we did the birthing classes, and then I didn't do like a pain-free birth series, but I did do like I read a book on oh man, I gotta find that book.
Supernatural Childbirth.
Maybe that was it.
I just bought that. It's like a very short book.
Maybe I can't remember what it was called now. I'll have to remember. I have to look my books. But it was basically just saying like, you have to tell your body that you're okay. Yeah. And some people, right? It's the same situation. If you don't do any techniques and you're a person who has high pain tolerance, like I don't think it matters because I have high pain tolerance. It's the idea of like your body goes into fight or flight, right? Or freeze. So in my case, my body was like, oh, we don't like this pain. We're going to stop what's going on. Right. And so you have to get yourself out of, maybe there's previous birth trauma, or maybe there's just trauma in general and that has gone in your life and your body is reacting to this distress response. And you have to train your mind and your body to say, we are safe. We're in a safe environment. My body is doing everything it's supposed to do. Get out of the what ifs of the situation. Let me experience this. This will pass. The thing that I went through for first baby that I think didn't lead me down the right path was that I am competition, right? So like, I am like, okay, because, they talk about like 3-hour births or 2-hour births or whatever. I don't like that because there are steps to labor. There is the pre-labor situation.
It's incredibly
long. So like when we're talking about, when people are like, I was 3 hours in labor, like you were not 3 hours pushing. I mean, maybe some people are, right? Or I'm sorry, 36 hours pushing. Like you're maybe like 3 hours and then that's when interventions start to happen, right? But normally speaking, it's that those 36, 48, whatever hours is your body prepping. So it's your cervical wall thinning, it's your dilation happening. There are different stages of birth and each stage feels a little more uncomfortable than the rest. And then you hit the transition and you just go out of body because you're like, it's like pass out mode, right? And it's not because it's painful, but it's because your body is like, it is like, get this thing out of me. It's go time. And that part's so quick. But it's the lead up part where you're like, I don't know if I can do this. I don't know if I can do this. I don't know if I can do this. So those classes are so important because in those moments of I don't know you can do this, you're like, how do I build happiness? How do I put back? How do I push this fear out of me? And I put in this oxytocin that like I am safe, baby's okay. Is it lighting? Is it breathing? Is it certain music? Is it telling everybody to get the frick out? Like that was for me. With the doula, she was like, dude, when people are around, you pay attention. You need to just shut the doors, close the windows, turn your phone off and get everybody the F out because you cannot like think about other people right now.
Just so you know, guys, like she was 2 hours away from having to go to the hospital.
We were a little past that time. We were they were like, you have 1 more hour. Yeah. She was like, I'll give you 2 hours. And then she was like, I really want you to go because I'm a little bit nervous about the care that you're going to receive. Right. So I was like, okay. And then literally closed my eyes within 20 minutes. I was like, something's different.
Yeah.
Of everybody going away, just being able to quick nap, take a prayer, like everything just progressed. And so it's really, and it's hard to do that when you're prenatal, even in your, like, especially your first time pregnancy, because you don't know what's going to bother you in pregnancy. Like, you could love the smell of, what was the thing I love so much? Sage. Oh my God. I wanted to throw up. I was like, no more, don't do that. Right.
Yeah.
You might love the smell. You might love the sound of a certain music. And then you're like, absolutely don't play that. That's bothering me.
Yeah.
And it's okay. Like, nobody should take personally what you do in labor, because it is not who you are.
Yeah.
Like, but everything changes because your hormones are just raging and things are pressing and things are turning on. And so if you can imagine, the world around you is probably chaotic because you're in labor, right? If you think about like when you're in like down deep labor and they bring like 20 people into the room to like give you birth, like if you can imagine the room's probably in chaos, then you have to give yourself the grace that your body is also doing all of this too.
Yes. And I think it's like a big thing that they teach you how to welcome those contractions instead of, oh my gosh, I'm having a contraction. Get this out of me. I don't want to have a contraction.
Yeah.
Like, you like, I gotta be like, my body is working. Like, it's
because
just a mindset.
that's normal. If you felt that pain on any other level in life, you would go to the hospital.
Right.
So maybe you are, but as in like something happened, you got hit by a truck, like literally, or, a bone's breaking, or you burn yourself. Like, you feel that pain and you're like, ouch, that's not good. And so your whole life up until labor has taught you that, like, when you feel these feelings, something isn't right. And that's not the case in birth. And so your mental focus just has to be like, everybody is around me, that I have a team that I trust. That's what's most important, is that there are people around you that trust, because if something is going wrong, they need to be able to cue that, right? You can feel it in your body and you can be like, hey, this doesn't feel like the way it should be. And then they react. But up until that point, everybody should do the hardest they can to make sure that you are in a state of peace.
Yes. Yes. Absolutely.
Bubble of peace. That's what I learned in Hypnobabies.
Going to your birth, I actually referenced when I was meeting with my doula, because we were going over like the stages and everything. I was trying to reference your birth specifically and like the stages, because I remember it took forever. Like, we went like on Sunday to go get a massage, and you didn't give birth until Wednesday or Thursday.
Yeah.
It was a long time. So you're like, yeah, my water broke or something happened.
Yeah, we thought my water broke, but it didn't. It was like a hairline fracture, essentially.
The
and then I would
plug or something. I forget what it was.
And then they weren't letting me, or they weren't letting, my body wasn't like, I was dilated, but my cervical wall was not softening.
Okay.
So like, I couldn't push, right? So I wasn't feeling, and then again, right? Like, I just felt like there was a lot of blood.
She would not let me also cancel this podcast that we had scheduled on Wednesday.
Did we cancel? We did cancel it.
Yeah, it was with the To Die For people.
Yeah.
And you're like, actually.
Yeah, I'm having this baby.
So funny. You were just trying to do all the things. I'm like, you're technically in labor. Are you sure?
Yeah.
But sorry. And then last thing that is different this time around, then I'll wrap it up, is God. I really leaned into my faith. Obviously, we're a God podcast now. Not that I didn't believe before.
The Jesus trap.
Yeah. Where are you? Not that I didn't believe before, but like really just looking to him a lot more. If you saw me last time trying to do all of these exercises and everything, I was a stress ball. I'm really relaxing. And like at the end of the day, I'm believing God's plan for this. And if the only thing I'll be disappointed is investing in all this stuff and like spending the money. But at the end of the day, if I have to have another C-section, that's God's way. There's probably there's a reason why this baby is not flipping, right? Like there's a cord that's, something's off.
Yeah. I mean, that what you're doing is essentially is biblical too, right? Like,
yeah,
there's only so much you can do to follow and to help yourself. And then there's a point where you have to just release everything that you expect and be like, okay, whatever is meant to be is meant to be. And I have to allow that. Surrender. Oof.
You didn't see it. I got on Instagram the other day and I was like, Brittany talked a lot about surrender this past year. And I feel like that's a key word that's been going through my mind, is that eventually I'm going to have to surrender to this stuff, but I'm in control right now and I'm doing what I got to do. So I don't want to look back and be like, well, what if I had done this?
Right.
Trying to do all the things. Right. But at the end of the day, like, he's with me. I've been reading a lot in the Bible, like about childbirth and this and that. And just, I love like these childbirth stories and everything like that within the Bible. So that's something that I I have on my side this time.
But what you're doing now is not controlling. What you're doing now is helping yourself. And it's the mindset of like, this is going to work versus whatever is meant to be. I'm going to do everything I can to ensure the safety of the delivery this way, but whatever happens at birth is what is meant to happen.
Yeah. So I'll quickly tell you my plan. Plan A is obviously to have a natural birth, get this baby head down and have a natural birth. And then, if that doesn't happen, if I don't get a head down, I am debating on whether doing a ECV, which is they manually will turn the baby.
That's painful, right?
It's painful. Like, also like birth is painful too. So
I don't know about that.
So because they're transverse, I have a good shot of getting them down.
Just to go the other way.
Yes. Whereas when Easton was born, he looked at me. I think he was still like doing things. He was like, that ECV wouldn't have worked. He was really stuck in there. Like, thank God we didn't try that, because that's something he told me not to try that with my first. And I remember that. So I'm kind of going back and forth on doing an ECV if it comes down to it.
When does that happen?
37 weeks. So I'm not far. I'm 4 weeks away if I have to do that. And I'm going back and forth. I'm like saying, okay, but is that God's plan? Like, am I forcing God's plan at that point? Is this God telling me, hey, like, you can, like, don't do that?
No, I think you pray about it.
So,
I think you say, hey, God, if I'm meant to, like, you just say it right now. You're like, hey, God, if I'm meant to have this baby vaginally, then, help me find a way to, get this baby down. And then if by the 37-week mark, you prayed about it again, you're like, hey, God, if I'm meant to have this baby vaginally, let me,
give me
please guide my hand to book that. Let me, I don't want to do this if it's not meant to be. I'm not trying to move something that's not meant to move. So let me know.
Yeah.
And just give it to him.
Yeah. And that's exactly what I'm going to do at 37 weeks. I'm going to give it to him. So I'm debating on that. But if baby is head down, and we're going to do a natural birth, if it comes down to it, I'm okay with getting an epidural if I really, really need it. I'm going to try my best not to.
Yeah.
But I'd rather have a vaginal birth than a C-section at the end of the day.
Yep.
So that's kind of my plan going into it. And then, you know what? Scheduled C-section ain't so bad. Honestly, you're like,
I know you.
Baby's here in an hour.
I will say, a friend of mine had a emergency C-section, and she had vlogged her whole pregnancy journey, and so she was very open and honest about what had happened there. And I think about it, and I'm like, wow, the absolute layer, like it is there, like, just so you know, like it, and she's saying this too, like, you can have a plan for your birth. I plan to have a VBAC. I plan to do it this way. And then, but a C-section isn't any easier.
No.
The absolute bear of a woman that you have to be, because you're basically choosing your pain, right? Like, you might, like, the quote unquote easier labor of cutting through. You now have 8 to 10 weeks of healing said wound with a newborn on your belly. Like, I don't do well with healing wounds. Like, I'm not good at that part.
It is tender for months and months, almost up to a year. Like,
no,
it's
can't
like
do it.
pins and needles.
No, thankfully I haven't. I mean, not thankfully, but I just, like, I am not woman enough to handle a C-section. I know that. I will be an absolute baby. Like, because I do not do well. Like, when you work out, you haven't worked out in a while, and you do like squats, and then you're like, oh, I can't sit. I cry. For days. I cannot handle soreness. I do not like pain. I can handle any pain so long as I know that there's an end date.
Okay.
And that was the thing about with River, right? I was like, okay, I'm going to be in labor for this long, and then I'm going to hit here. So I know that at the end of pushing, because I had River, I knew at the end of pushing Lenny out, that would be the end of it. I'd be good. I'd have a few, like, afterbirth pains, but, like, who cares? To not know, like, to be like, oh, this is going to go on for weeks, and I'm not gonna be able to get up, and I have to clean this wound. And I'm not made for that. So I commend you on that.
Well, you don't commend me, because I actually had a very good recovery with my first. And, like, it's actually kind of shocking that I don't want to just go right into another scheduled C-section, because I was up and walking that in the day after.
Not I, said Brittany.
They were like, if you feel like you can walk, go walk. And they released me early. I was doing laundry the next, like, I probably did things I probably was not supposed to do, but they were like, yeah, you're the only one walking. Every other woman that had a C-section on this floor is not doing well. Like, I was like, okay. And so I know that it's normal to not do well, but I actually did have a really good recovery. So I can't really speak to that. Yeah. It's not fun, because yes, like you're just limited in what you can do, and like the scarring and like worrying about that scar if anyone touches it. It's more so like for me, it was touching it or someone kicking it, whatnot. And then also let me be a little superficial. It's summer. I want to get into the water. Like I don't really want to be 8-10 weeks not being able to get in the water. We live on the lake. Like I'm really weird about, I really don't want to get into that water, especially with like an open wound, like right here.
Yeah.
So like, I'd prefer not to have a C-section for those reasons too. It's again, a superficial reason. There's many benefits to having a vaginal birth. And I think what people also don't know is that you're only allowed to have up to 3 C-sections. They won't really let you have more than 3. And not that I want to have any more kids, but just something to note. But every time you do it, you're really damaging your body. Like you're having major
It's a major
surgery. So like it's better for your body to attempt a VBAC than to have another trauma on the same place
again. I didn't know that.
So that's another reason why I'm just so gung-ho. There's a lot of reasons, but yeah. So
wow, I'm excited for you. I'm so glad you're doing all the things.
Doing all the things. We'll see, it's giving it to God. We'll see what happens, but I'm excited.
So where's baby at right now?
Baby's been moving this entire episode.
Baby's like, yeah, Mom, I'm doing all the things.
Yeah, I'm doing all the things. So transverse, I think still, but I think the butt's here. It feels more like this versus like this. And I'm feeling it more. So I hope that we can get him down there. Midwife didn't seem concerned when I met with her last.
No, because you're what are you at, 32?
33.
Yeah.
33 weeks.
You usually go times 36 weeks, right?
Yeah.
So you got 3 weeks to make it work.
Yes, but everyone says that to me. Like, you have time. I'm like, yes, but we have to remember I was breached last time and I have that septate uterus. So the whole idea was for us to create
before baby
that
gets
room
bigger. Yeah.
Before baby gets bigger. So it feels like right now is go time at this point. So
okay.
Yeah. So I hope you guys enjoyed this, especially if you're on your VBAC or your breech journey.
Yeah. And honestly, if you had a successful VBAC, would love to hear those stories.
Yes.
all that
please, you guys,
good juju,
honestly, like that's one thing I need. I actually want to get on my stories. I love when I hear from you guys, but right now, like I've had so many people message me and say how they did all the things and it didn't help. And I don't need to hear that right now.
Yeah. We need positive
I need
stories.
positive stories.
Bubble of peace.
Yes, please. So give me all the positive stories. I need to hear them. I really, really do need that. So,
all right.
Thanks, you guys. Until next time, we are going to have a guest next time.
And it's not a baby.
I was like, what? Oh, we're bringing back the guest. But yeah, we can't wait.
Yeah. We're going to do a play date and tell, which we haven't done in a while.
Yes, we haven't done in a while. So really, really exciting in our new space. So
fun.
Yay.
Stay tuned.
All right. Bye.
All right, bye. Thanks for tuning in to Truth Moms. Remember, mamas, the truth starts at home.
If you enjoyed this episode, don't forget to subscribe and leave us a review. It really helps us reach more moms like you, and plus, it's free.
Until next time, stay strong, stay curious, and we will keep dropping those truth bombs. Bye.